Hello and welcome to the CX Files for June 18th, 2026. My name's Mark Hillary and I'm in Sao Paulo, Brazil.
And I'm Peter Ryan in Montreal, but getting set to fly across the pond to the UK, Mark, for both a client event in London as well as, you will love this, going to see Def Leppard play in their hometown of Sheffield at the end of June.
Excellent, excellent. Did you ever see what was that movie about the guy who founded his own bank? Uh,
Bank of
Bank of
Dave.
Bank
Love
of
that
Dave.
movie. Love that
Yeah,
movie.
yeah.
Yeah.
And of course, Def Leppard plays a big role in that movie because they do the fundraiser concert to allow him to launch the bank.
You know, some things are enduring in life, and Def Leppard is one of them. Honestly, when you look back at their entire catalog of music, it is truly one of the biggest success stories of all time from a rock and roll standpoint. I've seen them live a couple of times in Canada. Cannot wait to see them in their hometown of Sheffield. And it'll be an interesting one for me because I've never actually been to Sheffield, but very excited to go and very excited to catch up with some of my friends there, like Neville Doherty and Phil Kitchen, who reside in the Sheffield area. And I'm hoping will show me some of the more salubrious drinking establishments in that community.
I'm sure you'll find some, and you can come home with some cutlery from Sheffield as well.
Well, you know, any port in a storm, as they say.
Well, this week we've got Lara Klick, who is the founder and president of Klick Advisors. She's based in Tampa Bay in Florida. Now, Lara actually commented on one of our earlier episodes where we spoke to Melanie Disse about acting on customer feedback. And I guess the question in that previous episode was, why do so many companies gather so much information? You know, they ask, they have surveys, they gather opinion, they ask customers for feedback, and yet they rarely act on it. And Lara actually mentioned that this is particularly important in healthcare, which is a sector that she focuses on. And so I thought it would be interesting to have a sort of a follow up. So we did a call, and we talked about why is it so important to have this kind of feedback loop in healthcare, and why is it especially important to not ignore customers in healthcare?
I cannot wait to hear this episode. One of the things that came out of the chat that I did with Melanie a few weeks ago is the fact that there's a massive opportunity that is being ignored by so many organizations by not acting on customer feedback. Collecting this information is a literal gold mine. And when it comes right down to it, the healthcare sector is probably one of the ones in which it's most important. When we're talking about healthcare, we're not talking about I've got to complain about my mobile phone or I didn't like the service I had for my ISP. We're talking literally about what could have a major impact in terms of somebody's well-being and how they were treated, what could be done better. And I think getting somebody like Lara on to discuss this and getting to that level of granularity, getting to that level of detail around probably one of the most fundamental areas of our entire lives simply is fantastic in itself, Mark, because as as we're talking about, so many companies just don't use this information. But if they did, imagine what the improvements could be made. Imagine how things could be ameliorated in so many different aspects. And healthcare is one that we know, no matter what the country, is truly, I think, in need of this.
Yeah, absolutely. And every country has a different system.
Yeah.
Obviously, the US is insurance led, but clearly this is a highly regulated industry. I mean,
Yeah.
when you're looking at healthcare, when you look at financial services, these are all very highly regulated industries. So the way that these companies can interact with customers is tightly controlled. There is compliance there. And so it's even more important that when you get feedback from a customer in this area, that you actually have a process of paying attention to that and actually doing something.
It's funny you mentioned the term regulated because my experience is organizations that tend to fall under increased levels of scrutiny or compliance tend to use that as an excuse for either not collecting client feedback or if they are not acting on it. And there's no excuse for this. one of the things that I recall a few years ago was the fact that customer feedback or customer concerns were being collected in the United States as it related to the IRS, and the fact that 1 in 10 inquiries was being answered, and of those, half of them were being answered incorrectly. The president of the day mandated a more customer service focus based around the fact that information had been collected, concerns had been led and been brought to the table. In my view, whether it's healthcare or any other sector that has higher levels of scrutiny or regulation, information should be collected, number one, and number two, it needs to be acted on. And I cannot wait to hear what Lara has to say on this, because it's a conversation that we need to be having, in my view, at the sector level or at the vertical level.
Right, well, let's go straight to this discussion about acting on customer feedback in healthcare with Lara Klick. Hi, Lara. It's great to get you on the podcast. Now, you talked to me about a previous episode, which was Melanie Disse talking about why do so many companies ask for feedback, and yet they don't really utilize it. They don't get a great deal of value from it. And you mentioned to me that this is particularly acute problem in healthcare, because most healthcare organizations have got vast amounts of patient feedback and data. There's surveys, there's complaints, but many of them really struggle to actually use it or to use it to improve the service. So where do you see generally then the system breaking down?
That's a great question, and I think it's something that's very salient. And if you look at healthcare, one thing that's a bit of a differentiator in that arena is that a lot of those surveys are actually regulated and required. And so you have a combination of those regulated and required surveys with the vast amount of human-to-human interaction which occurs every day. And I think that people see the regulated surveys as kind of a check-the-box must-do, as opposed to identifying the incredibly rich data that can be held within them. There is no industry that I know of that has more data points than healthcare. If you think of electronic medical records, you think of all of those points of contact between human to human when somebody is being seen. And I think that the true struggle is taking that vast amount of data and identifying what are the core important aspects of it. What do the different types of data mean to drive improvement? And then most importantly, how do you narrow your focus into actually focusing on process measures rather than outcome measures to drive an improved experience? And so in healthcare, most often you hear of something called the HCAHPS data, which is the federally mandated data in the states. For that HCAHPS data, that's actually a patient safety survey. It's not a satisfaction survey. So if you're looking at what is being done compared to how it's being done, that dynamic in and of itself requires a lot of attention and specialization to ensure that you're most effective.
So what separates the organizations then? I mean, the ones that actually take some of this feedback and act on it, compared to those that are just sort of applying the mandatory feedback and then putting it into a dashboard?
So I think it's a combination of a couple of things. The first is, do they have the right specialized leader within their organization? And so I've been doing this for almost 30 years. And when I got into the field, I was a little bit of a unicorn. My organization was very forward thinking and progressive. And so they brought me in as an individual who specialized in only the patient perception of care. So we had plenty of physicians and nurses to take care of their bodies, and my job was to take care of their souls. And in healing, we know that if you don't engage that emotional side of people, you're not going to have good outcomes. So having someone who truly understands how to interpret the data is success point number one. And having that person not necessarily be the nicest person in the building, because you can't be nice, you have to be kind in this work. And it's very, very different. But giving that person the supports they need to be effective, giving that person the expertise and training is also very important. And then the third thing I'd say is that culture is the root of all of this. And when you're in an industry that is really emphasizing human-to-human interaction during crisis, culture becomes all the more important because your life is lived in points of stress and tension. So you're not making widgets. You are healing people during their worst times. And so that cultural expectation has to become muscle memory. And that's very hard work. So those are the things that I would say become important. The last thing from a data perspective is, what data do you give to whom, and what does it look like when you deliver it? If I'm speaking to a board of directors or a group of C-suite people, I'm going to look at outcomes. I'm going to be very scientifically focused. I'm going to be very high level. A nurse at the bedside could care less about that. For the nurse at the bedside, I'm going to tell them a story. And I'm going to talk about Mrs. Smith and how you helped Mrs. Smith get to her son's bat mitzvah last night. I'm going to personalize that work because that's what the person doing the work cares about. So knowing what data to give to which people and in what format, I talk about that a lot in the book I recently wrote, to make sure that you have the right audience with the right information. One size does not fit all in experience.
Yeah, and it seems that maybe that's one of the problems here, in that a lot of the feedback is kind of mandatory. It's part of the compliance process, and you actually need to sort of change the system of feedback and that may be very different in very different types of healthcare organization as well. And I guess it also depends on the point at which you're trying to get feedback, whether it is like a personal conversation, or is it just, an iPad, with a survey or something. So, I mean, is that one of the big problems here then, that we really need to sort of think about the entire feedback system and perhaps it involve the cultural change as part of the change to the feedback system itself then?
I think that we do. And I think that, and I'm going to nerd out a little bit because I love data. Data is my love language. And I get very interested in digging deeply in both the numeric and narrative data that comes forward. Because again, in healthcare, we have the gift of a lot of narrative data. And so putting that narrative data into an AI format, finding those trends, but then also finding that one person, there's a phrase in healthcare, the N of one. So anyone who's on this podcast knows that you have to have statistical significance and enough data to make decisions. But if it was you or your loved one being cared for, we call that the N of one. That is the most important thing in your world. And so knowing how to take that narrative and the numeric data, and then going beyond just the narrative and numeric data and making it meaningful to the listener. So I don't know any healthcare provider who says, I'm going to go into the hospital and harm someone today, or I'm going to go into the clinic and make people wait for fun. Nobody does that. So taking, for example, a clinic wait time, if you're waiting to get an appointment, access is what we call it. Talk about the impact of why it's important that you're seen faster is also a key part of it. Make the data personal, make the data meaningful. Make the data a story no matter who you're talking to. And then the second thing I'd say is that there are sometimes I wish I could go into an organization and help them improve and never show them a survey result, because the survey results are all outcome metrics. That's not where you need to concentrate. You need to concentrate on your process measures. So if you want to improve the updates that people receive in a waiting room in an emergency setting, you can show them what people said about the wait time in the emergency setting from a survey, but isn't it more power to say, to improve this, we are going to give people updates every 15 minutes, which will include a question about whether they've had any change in their status, an update on their current status, and an apology for that wait. And you measure that because that's what people can control. And if you measure the process, the outcome will come.
Yeah, that's clear. And I've seen something on your LinkedIn. You've mentioned quite often that complaints are a gift. That's actually the terminology that you used. And it's funny because most organizations don't treat complaints as a gift. It's something to be avoided or suppressed. It's noise. But how then do you use complaints to actually drive forward improvement rather than you just want to suppress them because they're tiring to deal with?
Well, you should, first of all, never suppress them, because if people don't complain, they'll quietly take their business elsewhere and you're going to have leakage. So you want to give people every opportunity to give you feedback you can, especially if they've had friction that they've experienced that you need to address. And I'm going to just jump up on my soapbox for one more moment. So I don't like the phrase service recovery. Especially in my field, which is a relationship-based field. And maybe in the transactional world, if you go to a restaurant and the food is cold, you don't have to pay for it. That's service recovery, recovering the service. But if you're in any field that is relationship-based, that depends on long-term customer engagements, you're not recovering the service, you're recovering the trust. So I prefer trust recovery as the way that I present it. And so if you have somebody who experiences friction, in point of fact, what you've done is created an environment where they've lost faith and trust in you. And so if you don't know that that is occurring, you can't fix it. And so you want to actively say, what questions, concerns, worries, or friction did you experience during your stay? And then if they give you that gift of feedback in that moment, because frankly, especially in the healthcare field, the power dynamic is such that they're afraid to tell you when things go wrong because they don't want you to somehow retaliate against them. So again, that's a gift that they trust you enough to give you honest feedback. And you need to value that they took the time and they cared about you enough to give you that feedback rather than simply taking their business elsewhere. How do you use that data? Well, first of all, just like anything else, you're going to quantify it. You're going to do deep dives into the narrative often associated with that. Put that through whatever AI systems you're using to use those large language models to identify trends. Identify through that, for example, I'll use the number one complaint that happens in healthcare. Every healthcare organization everywhere in the world, waiting time is the thing that you're going to hear the most. It's the most frustrating thing, especially in emergency settings. It's because that person has a need and they have anxiety around the need, and they need that anxiety around the need and the need to be addressed. Now, you may not be able to magically double the size of your emergency department, but what you can do is put into place reassurance and communication for when people are waiting at how you're ensuring their safety. And that's where you take complaints about waiting time, you turn it into a system, a process. You do those proactive updates every 15 minutes. And that's going to reduce that anxiety and it's going to build that trust. And you get that from hearing from your patients or your customers.
Yeah. And are there repeated or very common complaints then? I mean, I've seen you talking about closing the loop with patients, and this is this idea of like achieving perfection, what the perfect service. I mean, what does good actually look like then? Because you were just talking about taking complaints and then operationalizing them, in actually changing the process based on the complaints. But are there repeated types of complaint then?
Absolutely. So the number one most received complaint, again, across all aspects of healthcare, is that waiting time, but it's not really waiting time, it's communication. So if you look at a highly complex process like delivery of medical care, wherever that medical care is delivered, would you love Six Sigma perfection in those moments? Of course you would. And there are certain aspects within those moments that are high danger times. So for example, the administration of blood. I use that as an example very frequently because it's such a dangerous exchange that happens in healthcare. If somebody is giving you blood, there is a checklist that must be completed 100% of the time. It's like flying a plane and doing the checklist before you take off. And in those moments, we've been able to define a very concrete series of events which must occur. If you take that and you extrapolate out communication, you have a lot more variables than hanging blood or flying a plane, because now you have humans interacting with humans and all of the verbal and nonverbal aspects of that. So instead of having a 100-point checklist, you have potentially a 1 million point checklist, and getting to Six Sigma perfection in that world is unlikely. Instead, what you have to do is you have to say, this is a high impact moment. And for this moment, changing from the night nurse to the day nurse, going from the doctor in the front to the doctor in the back. For those moments, we will define the checklist of 100 things where we want Six Sigma perfection. When we hang blood, we want Six Sigma perfection. But if you tried to do that for every interaction, the cognitive load on your team would be so significant. I'd love to say you'd achieve it, but I doubt that it's possible.
Yeah, yeah. And I was just thinking it might be a little bit off track, but has the Dr. ChatGPT changed the kind of interactions then, or the level of trust in medical services? I guess people are constantly cross-referencing with AI to check the advice they're being given.
They are, and it's a huge conversation right now in my field. And in some places, that AI is saving lives, and we know that. So the number one way that people die in hospital settings is something called sepsis. So it's a systemic infection which occurs in the body, and that is the number one cause of death in hospitals. AI can actually mine the data and identify early warning signals before it becomes readily apparent from the human eye. And we know we're saving lives by using AI in situations like that. However, that patient in the bed doesn't want to hear that that's what saved their lives. They still want to say the AI notified your physician, who then used their extensive training, years of experience to take the data points to actually evaluate you. And that's what happens. There's something called a sepsis alert that goes out in a hospital. A specialized team immediately responds to the moment and takes the human aspects into the clinical aspects, because medicine is an art and a science. I think that if you look at the patient in the bed, and I'll use a story. So my father has been having some health issues, and he went in for a procedure, and the physician was giving us some results. I've built an AI bot for my father's health conditions. And as they're talking, I'm entering the latest data and cross-referencing it with that piece. In that moment, the care provider can either get very, very suspicious of me putting information in my phone, or, and this is where the conversation is, they can partner with me on it. So how do we drive people to the right sources to make sure there's not artifact in that AI? And then work with them in that moment. And that's where people like me come in, right? So I can give the doctor the words to use in that moment. And the words would be something like, I see that you're entering this information into your phone. Do you have AI resources that you're searching? Because I would love to provide for you my trusted sources so we can collaborate on a successful outcome to this. But the conversation is that physician and that patient both are pretty suspicious of the AI in between.
Yeah. And it is quite a cultural change. And I mean, traditionally, feedback has been kind of managed by like a CX team or a patient experience. And this is clearly the kind of silos that we see in most organizations. You know, you have marketing, sales, CX. But clearly, from what you're saying, there's a lot of relationship building and interactions between patients, doctors, other medical professionals. How do you sort of create accountability across the entire organization then? Because it's not just the survey itself, that getting feedback from the patient is not just a function only of like a CX team only. It seems as if you need to change the entire culture.
You absolutely have to change the entire culture. Now, I do think that healthcare has an advantage over some other industries in that people who go into healthcare have an intrinsic desire to help others. It's far too difficult of a field to go into if you're not motivated from some place of wanting to do the right thing by people during times of crisis. And so it's, because we're not fixing widgets, we're fixing people with lives. So that actually, from a cultural perspective, really gives our industry a bit of a leg up, because you can lean into that desire to help others as you're building the culture. So you have to talk about what needs to be done. So, for example, putting the keywords in place for critical interactions. You can talk about why it's important. i.e., you have to talk about the anxiety that's caused and how anxiety is actually harm in a patient. And so you have to dig deeply into that and how communication can improve the physician's life by reducing anxiety and reducing the questions and the distractions in their day. I think that where we struggle in healthcare, especially because ultimately we're scientists, is the how. And so you can take that evidence-based best practice and say, we need to do this. But just like anything else, you have to turn it into, and this is how we're going to do it. And that's where every single person that is representing that organization must be involved in the how. And so it gets back to the process measures, and it gets back to the reliability, and getting that reliability in place in a way that people own their own actions and really measure themselves. And we do that a lot when we work with organizations because you want things, we call them accountability partners. So if you have two nurses on a floor, the leader, it's unlikely they're going to watch a nurse every day. It's just not physically feasible to do. But if you partner with a colleague and you say, hey, can you come and watch me do this interaction and give me feedback on how I do? So you have that trusted colleague giving you the feedback. Now you have individual buy-in.
Yeah, yeah, absolutely. And I think that point that you made there about going from having some insight, whether it's feedback, communication, or you've identified where you need to change. And the real question then is, how do you actually do it? So, I mean, do you have any examples or what have you seen that actually works when you're trying to change how you deliver care?
Sure, I'll give you a specific example, and it's something that I love. It's gamification. And I am a proud Pollyanna. I believe in coming at everything from the positive sides of things. I'm a realist, but I'm a Pollyanna. So we try to drive improvement in the healthcare world by identifying what's going right and amplifying what's going right, rather than focusing on what's wrong. Because frankly, we're lucky in our data. More people love us than anything else. If you look at our top box performances, people love us. But it's about the consistency of that love and making sure that you have that consistent performance. So we were doing something called purposeful hourly rounding in an inpatient setting. And we had a unit that was struggling a little bit with creating that consistent application of the best practice. So we actually got our patients involved and we made our patients secret shoppers. And so we had the nurse leader rounded on the patients and said, hey, by the way, my team is trying to get better at making sure that we take care of your comfort every time we come into the room. I'm going to give you this ticket. If the next person who comes into the room asks you, are you comfortable? Is there anything I can do to make you more comfortable? Would you just give them this ticket? So now I have a free secret shopper in my walls. I did warn my team, because I'm sure you know, you never want to surprise people with secret shoppers. It destroys trust with your team. So they know that one of the patients on that unit had the ticket of the day. And then whoever got that ticket got a prize. It wasn't an expensive prize. It was a pen or a piece of candy, which for nurses, it's like pens and candy are the things you do. And what was really interesting about that example is when they put it together, the nurse leader actually asked the staff, what is valuable to you? And what do you think would be the right words? And how do you think we could get better? So they co-designed this intervention. You saw their compliance and asking about comfort move from a 25% reported compliance to a 75% reported compliance in the space of 3 weeks. So from a performance improvement perspective, that's incredibly rapid improvement. And the best part is they sustained and continued those gains. And their process measures improved, which meant that their outcome measures also improved. So that's an example of how you take a concept, checking on comfort, and you turn it into an application which is replicable and is reliable.
Yeah, absolutely. Yeah, and clearly, just getting that buy-in, it really is a cultural change.
Well, I am a huge proponent of co-design. One thing that I think is really essential in co-design is you want to put the people who do the work at the table, but to the extent that you can within your industry, you want the people receiving the work at the table as well. So we're blessed again in healthcare to have something called patient family advisory councils. So we actually very intentionally curate a group of former patients and their family members to become partners on anything that impacts their care. So we call it nothing about you without you. And so if you're going to change a process which involves a patient should be sitting at the table from day one of that process change. It took a little bit of a hit during the pandemic because those used to be in person. I was very blessed at the organization I was working at that I had a full-time person that did nothing but get patient voice. So they coordinated that council. And so from day one of the pandemic hitting, when everybody got locked down, they began working with our council members to teach them how to do virtual conversation. And what we found is we didn't only sustain that feedback, we grew it during the pandemic because all of those people wanted to talk to their grandkids too. And we were giving them a service. We taught them how to use Zoom. And then they brought their friends on board. And so we had approximately 55 people for our main hospital that we could have an informal focus group up and running within 48 hours of a concept. So that really rapid improvement cycle. So that's co-design. And again, you put the nurse at the bedside, you put the patient receiving the care, you put them at the table, and you have a conversation about what's going to work.
Okay, just to wrap up then, I mean, if you walked into a healthcare facility or hospital tomorrow and you found that they've got lots and lots of feedback, they have lots of information, but they're very poor at asking that how question. You know, we've got all this data, we've got all these ideas, we can see where the problems are, but what are the sort of 3 steps that you would advise on turning that actually into action then?
So the first thing is to get very curious. And as human beings, we love to live our lives in judgment, and we have to get out of judgment and move over to curiosity. So asking, why? I'm a big fan of the 5 whys. Start going in and employ your 5 whys. Why is this that way? Why? Because then step 2 is you're going to move to how. Take those whys and transfer into the how conversation. Well, how can we improve this? Well, how would that get better? How do we create reliability around that? And so that curiosity is really essential. And so that's step 1. And you as an outside observer are also going to be doing observations. So if you have a pile of magazines in your garage that you walk by for a long time, eventually you stop seeing the magazine. So having that outside party to come in and really do deep dive observations and then give feedback, this is what I saw, that's where someone like me comes in. I go in, I embed myself, I ask lots of questions, I observe. But then the third piece is you may have dissatisfaction with your current state. You may have a vision for what your ideal state is, but the third aspect in the formula for change is you have to have those achievable first steps. Who is doing what, when, and how are you going to measure it? How are you going to redesign it if necessary? And how are you going to embed it into your daily work? And it's only through those first steps, simple and achievable, that you will actually find outcome. So I can help people put that together in a way that's going to resonate with their teams.
All right, that's perfect. I think it was a really good conversation, and especially interesting that we were carrying on from an earlier podcast as well. So really, thank you very much, Lara.
Absolutely. And if your audience is interested, I actually wrote for healthcare providers the 30 years of experience I have. It's a book called Simple Doesn't Mean Easy, because this may sound awfully simple, but my goodness, is it difficult to achieve.
No. I can tell that we've really only scratched the surface. This could go on for hours.
Absolutely.
I'll definitely make sure that we put a link to the book as well in the show notes. Okay.
Wonderful. Well, Mark, it was a pleasure to be invited to talk to you, and I welcome anytime anyone wants to engage with me. I love to talk to people if you haven't guessed.
Thank you. Thanks for listening to the CX Files podcast. We really appreciate your feedback and suggestions. You can reach myself, Mark Hillary, or Peter Ryan via LinkedIn. Please also leave a rating or review on your favorite podcast provider, as that helps more people to find us. As always, we'd like to thank Chris Haig at Traction Media for the CX Files graphics. See you next week.